The government has been urged to formalize daycare services and strengthen standards and safety measures for childcare providers in the country. Players in the sector emphasize the need for regulatory frameworks, quality assurance mechanisms and improved oversight to ensure safe, accessible and high-quality care for young children. The recommendations were highlighted during the dissemination of research findings by the Population Council Kenya, which focused on the need for scaling up the centers to reduce effects of unpaid care work among women in low-income settings in the capital.
Childcare plays a critical role, and especially so in urban areas, as many working mothers struggle to balance paid work with taking care of their children. A research by Population Council Kenya into the social franchise model of daycare centers by Tiny Totos recorded improved outcomes of developmental milestone for children who attended daycares.
Mothers whose children are going to this daycare service for about 14 days and above in a month seems to have better outcomes in terms of developmental milestones, growth and nutrition, which says a lot about the program and activities going on.
Dr. Timothy Abuya, the lead researcher on the social franchise care model, noted that improving of services of daycares significantly helped free women to contribute in economic activities.
When you improve services that women seek in these childcare services, it reduces the amount of time they spend on unpaid. And how does that work? In three ways. Number one, women who then take their children to daycare services have less time to do the childcare roles they would have taken. So that time, they would go and do something else.
Judy Masharia, head of community services in Nairobi County, said the research will help to inform policy development in the childcare space.
The research on the social franchise daycare model provides important evidence on how we can better support families while improving outcome for children. It also offers practical insights on how such models can be strengthened, scaled and integrated into broader childcare systems.
Faith Kamande of Toto Plus Daycare called for formalization of daycares in Kenya, noting this will improve safety standards and the overall outcomes of children in these centers.
I think the biggest challenge has been that daycares have not been recognized. The fact that we don't even have a policy on the same, it means we are on free flow. Everybody is doing as they wish. We don't have any standards, any minimum requirements that for you to be able to take in somebody's child, you should have been able to go through a certain basic training.
Players in the sector were urged to use the evidence presented to strengthen childcare systems and help reduce the burden of unpaid care work and improve outcomes for children and families across Nairobi County. Caroline Kamau for Lunchtime News.